How do you know if a colon polyp is malignant? Imagine discovering a tiny growth inside your colon and wondering if it's harmless or something more serious. That's a common concern, and understanding how doctors determine if a colon polyp is malignant can help you feel more informed. Most colon polyps are benign, meaning they are not cancerous, but some can develop into cancer over time. The key to knowing whether a polyp is malignant starts with how it looks during a colonoscopy. During this procedure, a doctor examines the inside of your colon with a flexible tube equipped with a camera. They look at the size, shape, and surface of each polyp. Larger polyps, especially those over 1 centimeter, tend to raise suspicion. Polyps with irregular, ulcerated, or depressed surfaces are also more concerning. Flat or sessile polyps, which sit flush against the colon wall, are more often linked to malignancy than those on stalks. Advanced imaging techniques like chromoendoscopy, which uses special dyes, or magnifying endoscopy, can reveal surface patterns and gland structures that suggest cancer. Classification systems such as the Kudo-Pitt pattern or NICE classification help doctors predict malignancy based on these visual clues. If blood vessels appear twisted or irregular, or if the surface pattern looks disrupted, the likelihood of cancer increases. Sometimes, doctors use endoscopic ultrasound to see how deep the polyp has invaded the colon wall. This ultrasound helps determine if the cancer has spread beyond the surface layer into deeper tissues, which influences treatment options. The most definitive way to confirm if a polyp is malignant is through microscopic examination after it has been removed. A pathologist checks the tissue for cancer cells invading the submucosa, assesses how differentiated the tumor is, and looks for signs of spread into blood vessels or lymph nodes. They also check if the edges of the removed tissue are free of cancer cells, which is important for deciding if further treatment is needed. While most polyps do not cause symptoms, some signs might suggest a larger or potentially malignant growth. These include rectal bleeding, blood in the stool, changes in bowel habits that last more than a week, or iron deficiency anemia from slow bleeding. Abdominal pain or cramping can also occur if a polyp blocks part of the bowel. Because many polyps do not cause symptoms, routine screening colonoscopies are vital for early detection and prevention. Starting screening at age 45 or earlier if you have risk factors can help catch polyps before they turn into cancer. If a suspicious polyp is found, it is removed and examined carefully. This process is essential for early diagnosis and effective treatment. In summary, determining if a colon polyp is malignant involves a combination of visual assessment during colonoscopy, advanced imaging to evaluate invasion depth, and microscopic analysis after removal. Regular screening and early detection are your best tools to prevent colorectal cancer. Always consult your healthcare provider for personalized advice and follow their recommendations for screening and management.